Kelp has been an essential component of Eastern Asian diets for centuries. In fact, this diet introduced kelp to different regions around the world. The potential health benefits of kelp are wide-ranging. It can fight an iodine deficiency, it can help with diabetes, and it can prevent blood clots. Kelp, or brown algae, is found on the coasts of Korea and Japan. It can have many therapeutic and nutritional benefits, and is a rich source of iodine, minerals, antioxidants, fiber, protein, and healthy carbohydrates. It can also improve diabetes, reduce blood clots, and even help to fight hepatitis C and breast cancer. Kelp is an excellent source of iodine, potassium, magnesium, iron, and calcium. Depending on the type of kelp or seaweed, the nutrient profile can vary greatly. Laminorin is a specific type of kelp in the brown algae family, and it's rich in nutrients like iodine, potassium, magnesium, calcium, and iron. Its compounds can also block tumor growth and spreading. Kelp also contains a complex, long-chain carbohydrate or polysaccharide called fusidin. Fusidin is responsible for several potential effects of the kelp, including antioxidant, anti-inflammatory, and cancer fighting. Kelp is also an excellent source of vanadium, used in clinical studies to lower glucose levels in individuals who are suffering from diabetes type 1 and type 2. Fucoxanthin, a pigment found in the brown seaweed, can also boost weight loss. The high iodine content in kelp supports the production of thyroid hormones T3 and T4. If an iodine deficiency is severe and prolonged, the thyroid gland enlarges and forms a goiter. This can also lead to a lack of thyroid hormones or hypothyroidism. Kelp has potential cancer-fighting properties. Fusidin from the kelp can kill cancer cells and stop their growth. Nutrients from seaweed carry potential health benefits. Dietary fiber, peptides, lipids, and minerals protect the heart. They may help to reduce the markers of heart disease, protect the cells by reducing oxidative stress, reduce inflammation in the blood vessels, reduce high blood pressure, and decrease blood clotting. Sticks made of laminaria, a type of kelp, are used to induce birth and to perform abortions. Different methods and amounts are used depending on the trimester, inserted into the cervix. The sticks cause the release of prostaglandins, and these act as hormones that help to initiate womb contractions. Laminaria sticks can mechanically assist in terminating a pregnancy for the first and the late second trimester of pregnancy. In one study, longitudinal, 171 late second trimester abortions were performed using laminaria. Only one had serious complications, no contraindications during delivery, and 9 required additional safety measures. However, there's much better and safer methods for inducing labour or abortion. Kelp has a high iodine content. It improved thyroid function in a study on 7 patients with severe motor and intellectual disabilities and hypothyroidism due to an iodine deficiency. Patients were given 1 to 2 grams of powdered kelp daily, and this treatment restored thyroid function, increasing the concentration of iodine in the urine. In another trial on 36 healthy people, the kelp increased the level of the hormones that stimulates the thyroid gland. However, excess amounts may have the opposite effect. In a Japanese clinical trial on 13 people, eating 15 to 30 grams of kelp per day suppressed the thyroid function, resulting in low thyroid hormone levels. Powdered seaweed pills reduce sugar levels in a study on 20 subjects with type 2 diabetes. This was taken daily for 4 weeks. It decreased the fasting and the post-meal blood sugar levels and the serum lipids. Also, the pills increased the HDL or the good cholesterol, which can help to prevent disease associated with diabetes. In another trial on 65 people, polyphenol extracted from 2 different kelp species lowered blood sugar, insulin resistance, and inflammatory markers. However, an extract with seaweed polyphenols was ineffective at lowering blood sugar levels both before and after a meal in a trial on 26 people. Kelp is a great source of vanadium. Oral vanadium supplements, 150 to 300 milligrams per day, given to 14 type 1 diabetic patients in a longitudinal study for 30 months, decreased the fasting blood sugar levels by over 30%. Vanadium also decreased the cholesterol levels. It caused no major side effects, with the exception of mild diarrhea at the beginning of the treatment period. Vanadium mimicked insulin in animal studies. In one study with diabetic mice, a vanadium-based compound reduced blood sugar levels and diabetic symptoms such as thirst, hunger, and weight loss with no side effects. A study of xanthinogen, which is a type of kelp, showed reduced body weight, waist circumference, and body and liver fat content in 151 non-diabetic obese women. It also improved liver function tests, and it increased the energy use at rest. Mice who were fed fats from seaweed had increased markers of weight loss in the fat tissue. Fucoxanthin, a pigment from the seaweed, produces these effects. In a cell study, alginate reduces the activity of a protein in the pancreas that breaks down the fats. Lower activity reduces fat breakdown, leading to fewer fats being absorbed after a meal. In a clinical trial on 24 people, dietary fucoxanthin prevented the formation of blood clots by increasing the production of two messengers, hydrogen peroxide and prostacyclins, in the blood vessels. Fucoxanthin infusion decreased the clotting in bleeding rats. The rats also had less inflammation around the areas of the swelling. They moved easier and they had better memory retention after the fucoxanthin treatment. Fucoxanthin supplements prevented blood clotting in the mice. The supplements also decreased the activity of blood clot stimulators, the platelets and the fibrin. In another study, fucoxanthin injections in the mice led to enhanced cell survival and function in the tissues with low blood supply or ischemia. In tissues with low blood supply, fucoxanthin decreased the cell death proteins, including MAPK, JNK, and capsase 3, and harmful compounds like reactive oxygen species. A study of 15 postmenopausal women, 10 of whom were breast cancer survivors, looked at the effects of brown seaweed supplementation over a 3-month period. Seaweed decreased an important marker of breast cancer recurrence by half after 4 weeks. Fucoxanthin, a key component of the seaweed, may fight the cancer and stop the tumour growth, based on both cell and animal models. In addition, seaweed supplements and algae extracts, including the brown seaweed laminaria, reduced colon, breast, and prostate cancer activity. Fucoxanthin injections, or fucoxanthin, when given in food, slowed the tumour growth in mice. The fucoxanthin killed cancer cells by activating the immune system via natural killer cells. And the fucoxanthin reduced the growth of leukemia cells, and it killed 2 out of 4 lines that were tested in a study. In another study in cells and mice, the fucoxanthin stopped the growth and the spread of lung cancer cells by blocking growth pathways. In a study of 15 patients with chronic hepatitis C, the fucoxanthin from the brown seaweed was used to treat virus-related liver diseases. After 8 to 10 months of treatment, hepatitis C virus levels in the blood significantly decreased. Additionally, this study also examined alanine aminotransferase levels, a protein whose presence correlates to more severe hepatitis C viral infection. The blood tests also presented a decrease in alanine aminotransferase levels. Despite the positive lab findings, these results didn't lead to a significant clinical improvement. In a rat model, fucoxanthin present in the kelp was used to reduce inflammation caused by immune cells in the brain. The fucoxanthin improved animal behavior. It reduced harmful compounds. It prevented neuron loss and protected the cells from damage by reducing reactive oxygen species that can cause neurodegeneration. In the brain and the spinal cord, a cell study on fucoxanthin reduced inflammation by blocking nitric oxide and prostaglandin E2 production. The fucoxanthin also blocked inflammatory proteins, cytokine, interleukin-1 beta and TNF-alpha, and inflammatory pathways by reducing NF-kappa B and P 38 MAPK. The fusidin reduced all important actors in the inflammatory cascade in cell studies. In brain immune cells, or microglia, the fusidin from the brown seaweed showed promise for treating neurodegenerative diseases caused by inflammation. Fusidin blocked the growth of the herpes simplex virus type 1 in infected mice. Mice who were given the fusidin had better survival rates. The treatment improved the immune response, the innate and the adaptive, and it increased antibody production. In a cell study, seaweed extracts, including kelp, protected brain cells from death in cell models of Parkinson's disease, and it improved cell survival. It also protected from toxins, helping the cells to avoid death via hydrogen peroxide and capsase 3. In a rabbit model, fusidin helped to create new vessels essential for communication with bones and bone repair. It also partially improved bone growth in rabbits with defects in skull formation. In human stem cells, the fusidin boosted the development of cells that build bones, called osteoblasts. Fusidin also increased the growth of new vessels, improving communication with the bones. In another cell study, the fusidin increased proteins that promote bone and mineral formation. Fusidin given to aged female mice increased the bone density and the weight, suggesting the fusidin can play a role in treating age-related bone loss. 10 protein extracts from Wakame sea kelp were given to rats with high blood pressure. Of the 10 extracts, 4 experienced decreased blood pressure after both a single dose and routine use. In a cell study, 5 organic brown seaweed extracts blocked an important enzyme that may contribute to high blood pressure, the angiotensin converting enzyme, or ACE. This enzyme is often a target for blood pressure lowering drugs. A 1% or 5% fusidin from kelp reduced the fat in mice that were fed a high-fat diet over 12 weeks. The kelp reduced the weight of liver and fat tissues, glucose and fats like cholesterol and fatty acids in the blood. It increased the activity of a protein that breaks down fatty acids, lipoprotein lipase, dissolving the plaque in the arteries. The antioxidant properties of fusidin from the kelp were confirmed in a cell study that tested its 2 major components, sulfate and fucose. Fusidin showed antioxidant effects, and it has the potential to be used as a natural antioxidant. A case study. A 45-year-old woman with no history of thyroid disease experienced an extended period of thyroid hyperactivity, or hyperthyroidism, shortly after beginning a kelp-containing diet. This later developed into a low thyroid activity, or hypothyroidism, caused by excessive iodine in the seaweed. A 39-year-old woman presented with a case of hyperthyroidism after drinking a kelp-containing herbal tea. The tea consumption led to the formation of a goiter, an abnormal enlargement of the thyroid gland. Similarly, a 40-year-old woman developed liver damage or hepatotoxicity after drinking a herbal tea that contained kelp 3 times a day for 2 months. From the excessive iodine, the thyroid gland swelled, leading to hypothyroidism and reduced liver function. And a 54-year-old woman experienced hair loss worsening, memory loss, fatigue, and nausea due to exceeding the prescribed amount of kelp supplements. This caused iodine toxicity, impairing the thyroid function, and possibly arsenic poisoning. This was present in the patient's urine and could have caused some of the symptoms. Dried seaweed can have high heavy metal content like cadmium, and cadmium can cause toxicity in the body. Levels of other toxic heavy metals like arsenic, lead, aluminium, and mercury can be found in Korean seaweed, but they were determined to be very low and not a health risk. Still, another cellular study found detectable arsenic levels in 8 out of 9 tested kelp supplements. The levels of arsenic were higher than the FDA tolerance level for certain food products. None were informed of the possible arsenic contamination. Kelp supplements have been linked to autoimmune disorders that cause red blood cells and blood clotting factors to become defective and attacked by the body's immune system due to the possible presence of the toxic metal arsenic. A UK-based study examining the accuracy of food labelling on edible seaweed and algae products surveyed 224 products, and only 10% of them contained information regarding their iodine content. Of these, 26 were deemed to potentially lead to iodine intake above the accepted level. 2 women experienced anaphylactic shock, an extreme, severe and possibly fatal allergic reaction when laminaria, a type of kelp, was used to terminate a pregnancy. The reaction included breathing difficulty, nausea and dangerously low blood pressure. As a huge source of iodine, kelp supplements can interfere with thyroid replacement therapies. Excessive amounts of iodine, similar to deficiencies, can alter thyroid hormone release and impair the overall thyroid function. Importantly, the FDA recommends a dose for daily intake of iodine at 225 micrograms. 1 gram of powdered kelp contains approximately 200 micrograms of iodine. Certain kelp-based supplements contain that in 1 tablet. You shouldn't exceed the recommended dose without consultation. Note, however, the Japanese consume up to 3,000 micrograms per day of iodine, so there's debate as to which is the best dose. Iodine can cause detoxification reactions when first consumed, as it helps to remove halides like chlorine, fluoride and bromide from the body. It can also cause detoxification symptoms, as it helps to eliminate yeast and other pathogens from the body. Vitamin C and glutathione can help to bind with these toxins and to assist in their removal while reducing the detoxification symptoms. People in some regions of the world may digest large-chain carbohydrates present in seaweed more easily than others. The Japanese, whose diet includes more marine algae, have a gut bacterium for seaweed digestion, and this is not present in Americans or Europeans. It originates from a marine bacterium via gene transfer, living on the surface of some sea algae species. For more information about herbs, supplements, and natural treatment plans, check out my website.